Hello friends, welcome to this edition of VBS Anatoma. Today we will see a very interesting topic, the technical details of which this is about positive patient identification for safe blood transfusion. We call it PPI. This is a very extremely important topic. Now, positive patient identification is a critical safety measure during blood transfusion, ensuring the right blood is given to the right patient and prevent potentially fatal errors. This process involves verification of the patient's identity at multiple stages using multiple identifiers and comparing them to the blood product label. Always ask the patient, especially if they are in a position to talk and communicate, to state their full name, first name, last name thoroughly, their date of birth. Check whether this tallies with the name tag or a band or an identity band or a barcode band with name and other details attached to the wrist or as a part of identification of the patient. Now, at this point, double verification, somebody has to be responsible and accountable to make sure that this verification is done. At what level? Patient's verbal information should completely match, thoroughly match point to point with the information, one on their wristband and second on the blood product label that is going to be transfused into the patient. This is a system that demands total committed responsibility. Now, you also have to verify that the patient's medical record number, it could be anything, IP number or a inpatient number or an outpatient number, whatever it is, the unique identifier, it should again match with the corresponding details of the blood product and the request form from the concerned clinical department. These are very, very important. Particularly the blood group, etc., has to be doubly checked. It's just not one person. Across the spectrum, all the people involved have to be totally accountable. But in particular, at this stage, at least 2 staff members should independently verify the patient's identity and match it with the blood product. Not only that, this bedside labeling of the sample should be done right there at the time of collection itself, so that there is no chance for any mix-up at all. Even at this stage, when it is done, it has to be totally cross-checked to ensure complete dependability of the system. Now, why is this important? Why are we giving so much importance to this procedure? Note, a wrong blood type transfusion may be very, very dangerous. Therefore, we have to understand that this system of checks is so important. It prevents incompatible blood transfusions, ABO, RH, everything. Incorrectly identifying the patient can also lead to transfusion of incompatible blood types, and hence this is a life-threatening problem. Therefore, just not that the blood group should match, you should also make sure that the correct blood product is reaching the correct patient. Otherwise, this can also result in difficulty and this kind of transfusion incompatibility. It also avoids all other types of transfusion reactions beyond the ABO incompatibility. Particularly, this will help us reduce the near misses and errors by confirming the patient's identity thoroughly and totally and with a guarantee at multiple points PPI helps to catch errors even before it reaches the patient. And therefore, if there is any problem, it can be intercepted and the patient can be saved. Challenges and considerations. First thing, the system, the personnel involved, the technology involved, all that has to be completely streamlined. More important than that, the patient should also be involved in the process. Encourage patients' participation in the identification process, but this cannot be given too much importance. The reason is, to the extent they can fit into the system, you can involve them. That means you should be mindful of their capacity and, more importantly, their willingness. Remember, they are patients, they are not in good health. Even if they are otherwise in a healthy state, they are able to help, that would have been different. But right now, they have come with a disease, or they are not in a good health condition, so they may not be able to give their very best. Nevertheless, to the extent possible, they should also be incorporated into the system. Remember, human error, there is a potential in this system for human error. Therefore, vigilance and accuracy during the identification process is the panacea for continuous monitoring all the time, is the one and the only panacea for avoiding such errors. Technology has a great role, particularly after these barcoding and etc. other technologies have come. Extremely reliable, provided they are done the right way at the right point of time, either at the level of the blood collection or at the level of the blood delivery, or tracking it along the system. Nevertheless, there is a strong emphasis on exploring and utilizing technologies so that their efficiency and accuracy of the complete system can be upgraded. Continuous monitoring, improvement is critical. It has to be kept in mind so that the entire effectiveness of the procedures can be upgraded or kept up to the benchmark required, and also necessary adjustments can be made from time to time. A few specific scenarios. Now you see, in certain emergency situations, sometimes it may not be possible for that. The pre-transfusion preparations and testing may not be complete or up to the benchmark required, and there may be an urgent need there. The life of the patient is critical and some amount of blood related interventions are required. In that case, you have to involve all the stakeholders, take a collective responsibility. The faculty, the people involved, the physicians, the nurses, the blood bank, everybody should be brought into the loop and held equally accountable to handle this crisis system. Next, neonatal and pediatric cases will come under special attention, because especially identification of neonates, infants, and very particularly twins, multiple births, etc. we need to be extra careful to prevent any mix-ups. Similarly, patients who are not able to communicate, patients with cognitive impairment, in that case it becomes even more mandatory, compulsory to involve the next person who is taking care of the person, the family relative or the guardian who is in charge of that patient. The caregiver or the family member should be enrolled or brought into the identification process. So these are a few points or major issues on which we have laid emphasis to help patients, technical staff, nurses, doctors, all healthcare stakeholders to understand the importance of this patient identification in a very important intervention into the human body. This was a presentation by VBS Anatoma. This was done by Dr. Sita Lakshmi. hematopathologist from Bangalore. Thank you for your patient hearing.